The graduation ceremony of these 21 mental health clinicians brings the ratio of 1 clinician to 6 medical facilities in the country. There are 600 health posts throughout Liberia, and these clinicians have the mammoth task of catering to this neglected sector of Liberia's health system. Delivering a keynote address, Deputy Health Minister for Planning and Research, Zolia, associated mental illness cases in the country as part of the consequences of the civil war, and also attributed a cause for mass citizens' actions against the government to some sort of mental illness.
Now, studies have consistently shown that exposure to adversity at a very young age is an established preventable risk factor for mental disorders. So what causes mental health problems and what are the consequences? There are many factors that contribute to mental health problems. They could be biological, through the genes, or they could be a malfunctioning of the brain, or it could be family history of mental problems, or life experiences, such as trauma or abuse, such as what we experienced during the madness we had in this country for 14 years. And the only plausible reason you can give for any Liberian to resort or to want to resort to violence because of quote-unquote corruption or quote-unquote injustice, to me, there are 2 reasons why somebody would want to do that. The first reason is either the person did not experience the war, the person was outside his country during the war, or the person has some mental problem. And the reason I'm saying that is nowhere in a democratic system where there are laws and rules will a citizen call for mass action to remove a sitting president when there are legal ways to remove any president that you don't want in your country. The law provides for that.
For her part, the president of the Association of Mental Health Clinicians, Korsapoe, Soumie, called on the Ministry of Health to beef up efforts to ensure that the sector is adequately catered.
Challenges such as lack of psychotropic drugs for our patients, medications are a rapid change in clinics and hospitals because it is not titrated as we were trained because of the inavailability of those drugs. Unwillingness or no interest of county health team, health nurses, supervisors in the area of mental health, resulting to clinicians not being allowed to work in their capacities in hospitals and clinics all around the counties.
Mounting the podium, Health Minister Dr. Gwenigale cleverly negated the lack of support to mental health issues to the failure of the county health teams to prioritize the sector.
The money that the Ministry of Health gets, we send by transfer almost $11 million to the different counties. That money is budgeted by the county health officers and their team. I wonder, in addition to setting money aside for their DSA to come to Monrovia, how much they put into their mental health program in their county.
These mental health clinicians were certificated, equipped, and the oath of acts administered to carry out the Herculean task of catering to cases of mental illness such as epilepsy, depression, autism, and severe, among the rest, post-traumatic stress disorder. The Carter Center Mental Health Program launched a 5-year initiative with the Ministry of Health in 2010 to address the broad range of mental health issues in the country. The initiative is targeting the training of additional 50 clinicians to reach the threshold of 150 mental health clinicians throughout Liberia. For Love TV Action News, I'm Cohort of Developmental Media Incorporated reporting.